In this animation, we look at how to help support your breathing with non-invasive ventilation, also known as NIV or Bipap. We also explain things you can look out for with breathing in MND. You'll learn about signs of breathing muscle weakness, how the Bipap machine works, when it is normally used, and who you can talk to learn more. More people with MND are choosing to use NIV as part of their care. The most common form of NIV for MND is bilevel positive airway pressure, which explains why it's called Bipap. A Bipap machine helps you breathe more deeply and effectively when your breathing muscles are not strong enough and can help you enjoy a better quality of life. As MND progresses, people often experience weakness of the muscles used for breathing. This weakness can develop at any stage of MND and makes your breath become shallower, which results in less air being drawn into the lungs. Less air means less oxygen is absorbed into the blood and that you can't effectively breathe out waste products made by the body. It is advised that you speak with your doctor about a breathing assessment soon after your diagnosis. This assessment will help guide your healthcare team about the best way to support your breathing and keep your lungs as healthy as possible. Deep breathing exercises, doing physical activities as much as you can, careful positioning, and coughing techniques may really help with your breathing. Your physiotherapist can provide advice and guidance. Some signs of weakness can be breathlessness, daytime sleepiness, fatigue, and shallow, faster breathing. There are other signs too, some that you may not expect. That's why it's really important to have regular reviews with your healthcare team. Other things to watch out for include disturbed sleep or loss of sleep overnight, morning headaches, decreased appetite, being able to speak fewer words per breath, impaired concentration or confusion, and irritability and anxiety. You should speak with your doctor as soon as possible if you notice any of these signs or any other changes with your breathing. Now let's look at what a Bipap machine is and how it works. A Bipap machine is a sophisticated pump that makes air go in and go out of a person's lungs via a tube and a mask. The machine provides the breath with just the right pressure and volume of air. The pressures are prescribed by your respiratory doctor to suit your particular needs. One pressure is for breathing in, and a lower pressure is for when you breathe out. This allows enough time for the oxygen you breathe in to get into your blood and for the waste products to get out. As a general rule of thumb, Bipap is considered when breathing falls below 50% of normal function. But you may also want to consider a Bipap earlier, depending on any signs of breathing weakness. As breathing muscles get weaker over time, the machine can be adjusted to provide the most comfortable breathing support for the coming months or years. Let's look at a few other important things about using Bipap. It's normal to take time and perseverance to get the settings and equipment fine-tuned and feeling right. You control the numbers of breaths you take, not the machine. It is usually used at night, but also may be used during the day if needed. You can choose from a number of different nose masks, face masks, and mouthpieces to try to make your breathing with the machine as comfortable as possible. Having regular discussions with your doctor, specialist respiratory nurse, or physiotherapist is an important part of using Bipap successfully. Studies show that using a Bipap can make breathing easier with MND and that it can really help with getting a good night's sleep. Getting enough sleep can help us feel rested in mind and body and generally feel better as we go through each day. Research has also found that Bipap can significantly and positively impact on well-being. Bipap can also prolong life. Learn more about managing your breathing with MND and the services and supports available by visiting www.mndconnect.org.au or call the MND info line on 1800 777 175 Monday to Friday, 9 a.m. to 4:30 p.m.